If you're watching this right now, chances are you're already enrolled in Medicare or you're about to turn 65 and wondering what the new year is going to bring. Maybe you've heard rumors about Medicare Part B premiums going up in 2025, or you've seen headlines about changes to deductibles. You're not alone. Every year, millions of Americans depend on Medicare to help cover their medical costs. And every year, the rules, premiums, and out-of-pocket expenses shift. Sometimes just a little, sometimes a lot. And here's the truth. Those changes can make a real difference in your monthly budget. So stay with me because in this video, we're breaking down exactly what's changing in 2025, what it means for you, and what smart steps you can take right now to save money and stay protected. I'm Dr. Michael from Medicare Mentor, and my goal today is to help you understand the facts without all the confusion. Whether you're new to Medicare or you've been on it for years, this is the one update you can't afford to miss. Because when it comes to Medicare Part B, even small changes can add up to hundreds of dollars a year. Let's start with the basics. Medicare Part B is the part of your coverage that handles your outpatient care. Doctor visits, preventive screenings, durable medical equipment, lab work, and certain home health services. In other words, it's what most people use the most often. It's also the part that requires you to pay a monthly premium and an annual deductible before coverage kicks in. So when those numbers change, it affects nearly everyone on Medicare. Now, let's talk about what's happening in 2025. The standard monthly premium for Medicare Part B is increasing. In 2024, the premium was $174.70 per month. In 2025, that standard premium is rising to $174.70 per month. Wait, no, scratch that. Let's get it right. The Centers for Medicare and Medicaid Services, also known as CMS, announced that the standard monthly premium for 2025 will be $174.70. That's an increase of about $9.90 from 2024. It might not sound like a lot, but over the course of a year, that's about $118 more out of your pocket. And if you're living on a fixed income, you know that every dollar matters. Now, the annual deductible is also increasing slightly. In 2024, the deductible for Medicare Part B was $240. For 2025, it's moving up to $250. That means you'll need to spend that amount on covered services before Medicare starts paying its share. But what's really behind these changes? Why do premiums and deductibles rise almost every year? The main reason is that healthcare costs continue to grow. Medicare pays doctors, hospitals, and suppliers for your medical care. And when those costs rise, Medicare's expenses go up too. To keep the program solvent, CMS adjusts premiums and deductibles accordingly. However, there's another important factor: income. Some people will pay more than the standard premium because of their income level. If your modified adjusted gross income is above a certain threshold, you'll pay an income-related monthly adjustment amount, or IRMAA. These higher income brackets begin for individuals earning more than $103,000, and married couples filing jointly earning more than $206,000. The more you make, the more you pay for Part B. Now let's pause here for a moment because this is where many people get confused. If you're drawing Social Security, your Medicare Part B premium is automatically deducted from your monthly check. So if you notice your deposit amount being a little smaller, starting in January 2025, this premium adjustment is likely the reason why it's not an error. It's just the new rate taking effect. And here's an interesting point. Historically, when Social Security benefits increase due to a cost of living adjustment, or COLA, those increases can sometimes offset the rise in Medicare premiums. For 2025, Social Security recipients will see a COLA increase of about 3.2%, which should help cushion the impact for most beneficiaries. Still, it's worth understanding how this fits into your bigger financial picture. Think of Medicare as part of your retirement plan. You've paid into it for decades, and now it's about making sure you get the maximum value out of what you've earned. That means knowing your costs, managing your coverage, and avoiding unnecessary penalties or late fees. Let's talk about timing, because enrollment windows play a major role here. If you're just turning 65 in 2025, you have a 7-month initial enrollment period that starts 3 months before your birthday month and ends 3 months after. Missing that window could lead to lifelong penalties on your Part B premium. So even if you're still working or have other coverage, make sure you understand the rules about when to enroll or when to delay safely. Now let's move to something most people overlook: the penalty for not enrolling in Part B when you should. The late enrollment penalty adds 10% to your premium for every 12-month period you were eligible but didn't sign up. And here's the kicker: that penalty lasts for as long as you have Medicare. So even if you're just a few months late, that mistake can cost you for life. But the good news is, there are exceptions. If you or your spouse are still working and have employer coverage, you may qualify for a special enrollment period that lets you delay Part B without penalty. Just make sure your employer coverage is considered creditable under Medicare rules. Now, let's dig a bit deeper into what your Part B actually covers, because understanding that helps you get the most out of what you're paying. For Part B covers preventive services like annual wellness visits, screenings for diabetes, cancer, and heart disease, as well as flu shots and other vaccinations. It also covers medically necessary services such as visits to your primary care doctor or specialists, X-rays, diagnostic tests, physical therapy, and mental health services. But keep in mind, Medicare generally pays 80% of approved costs after your deductible, and you're responsible for the remaining 20%. That's why many people choose to supplement their coverage with a Medigap plan or a Medicare Advantage plan. These options can help you manage out-of-pocket expenses and provide added benefits like dental, vision, and hearing coverage. Now, before we move forward, if you're finding this information helpful so far, take a second to subscribe to Medicare Mentor. This channel is dedicated to helping you make smarter decisions about your Medicare coverage, avoid costly mistakes, and find ways to save money on healthcare. Every week, we share practical tips, plan comparisons, and updates just like this one, so you can stay informed and in control. All right, let's continue. Another thing you'll want to be aware of for 2025 is the ongoing effort by Medicare to negotiate drug prices. While this doesn't directly change your Part B premium today, it could have a long-term effect on how Medicare manages costs in the future. Some high-cost medications administered in outpatient settings are billed under Part B, not Part D, and any reduction in those costs could eventually help stabilize premiums in coming years. So, what can you do right now to prepare for 2025? First, review your Social Security statement or your Medicare bill to see exactly what you're paying each month. Second, double-check that your coverage still fits your needs. Are you seeing the same doctors? Do you need more prescription coverage? Have your health conditions changed? These questions matter because the right Medicare choices can literally save you thousands of dollars a year. Also, make sure your contact information is up to date with Social Security and Medicare. Every year, CMS mails out notices about changes in premiums and coverage, and missing that mail could mean missing critical deadlines. And here's a tip that very few people talk about. If your income has gone down because you retired, lost a spouse, or had another major life event, you might be eligible to request a reduction in your IRMAA adjustment. It's called a reconsideration request, and it can significantly lower what you pay for Part B. All it takes is documentation of your new income level and a little paperwork. Let's take a moment to talk about what these changes really mean in human terms. A $10 increase in premiums and a $10 increase in the deductible might not sound like much on paper, but for someone living on a fixed income, it's another reminder that healthcare costs rarely stand still. It's about peace of mind, knowing you can afford your medications, your doctor visits, your lab tests without feeling anxious every month. And that's exactly why staying informed matters so much. Medicare isn't static. It evolves with the economy, with healthcare trends, and with legislation. The more you understand these shifts, the better you can protect your budget and your health. For example, let's imagine two retirees. Both are the same age, both live in the same state, and both are enrolled in Medicare. One of them checks her coverage each year, compares plans, and takes advantage of preventive care. The other ignores the updates and just lets things renew automatically. By the end of 5 years, the difference in what they've spent out of pocket can be thousands of dollars. The first person stayed informed, the second didn't. Which one would you rather be? That's why I always say, Medicare doesn't reward those who forget, it rewards those who plan. As we look ahead to 2025, here's what I want you to take away. First, expect a modest increase in your monthly Part B premium and deductible. Second, check your income-related adjustments and see if you can qualify for a reduction. Third, review your coverage and make sure it still aligns with your current health needs. And finally, never stop learning about your options. Medicare is complex, but it doesn't have to be confusing when you have the right guidance. Before we wrap up, I want to leave you with this. You've worked hard your entire life to earn these benefits. You deserve to understand them. You deserve to feel confident that you're getting the care you need without overpaying. And that's what we're here for at Medicare Mentor, to help you stay informed, stay prepared, and stay ahead of the curve. If you found this video valuable, take a moment to subscribe to the channel and turn on notifications. That way, you won't miss any of our upcoming Medicare updates, enrollment tips, and cost-saving strategies. And if you have questions about your own situation, drop them in the comments. I read every one, and I'll do my best to cover your questions in future videos. I'm Dr. Michael, and this has been your complete guide to the 2025 Medicare Part B premiums and deductibles. Remember, information is power, especially when it comes to your health and your money. Thanks for watching, and I'll see you in the next video right here on Medicare Mentor.